Hey everyone, today I want to talk about how to improve patient experience within the hospital. I know personally the hospital that I worked at, we started doing the nurse-led rounding with our interdisciplinary team members, which consisted of our doctors, consisted of case management, pharmacist, and of course the head nurse. So what they did is that they had their computer and we walked into each patient's room and basically did a bedside report with the family there. And as soon as we started that, we saw patient experiences go up. They were satisfied with their experience at Sentara Alma Medical Center, and it actually works better. And I'm going to go over exactly why it works better and why we need to do it more at the other hospitals as we do at Sentara, because basically with our competitors, I haven't seen other hospitals do nurse-led rounding because I used to work at Vidant and they never did that, but at Sentara they started doing it. So I want to go over how can it meet satisfactory with our patients. One, it can be clear communication. Just everyone on the same page. You have your patient in the bed who may not understand what's going on, so the nurse is there to basically go over with them what's going on with their care and basically clarify exactly what the doctor is trying to say to them, because with medical terminology it can be hard to understand, so it's good for the nurse to be there to help them understand exactly what's going on. It provides quality time with the patient. So usually doctors, from experience, they go in, they come right back out. And then later on, the nurses call them saying, hey, this has come up with the patient, I need you to come back. So instead of doing that, the nurse-led rounding can actually minimize that time. It can provide quality time between the doctor and the patient and the family members to get on the same page and let them know exactly what needs to go on with their care and how to basically decrease their stay in the hospital so they can hurry up and get back home. So of course the patient's needs are met, and that's our motto at Sentara. Is basically to say, I'm here for you, to make sure that you're in a safe place and that you're comfortable and know that you're in good hands at the hospital. Solutions for the interdisciplinary team member led by the nurse. Basically, I just went over mainly all of it. It's just clear communication with your nurse, your case manager, and pharmacist. The patient goals are met because of this. If they can sit there and communicate with everyone and be on the same page, it actually can decrease their time and stay at the hospital. Benefits of doing the nurse-led rounding is to increase productivity. If we get everything done in a timely manner, like for example, if a patient had spiked a fever or their white blood cell count started to become elevated, you want to draw blood cultures to figure out what exactly an antibiotic they need to be on in order to prevent them from having, going into septic shock, which is like their body's going in an inflammatory process. It causes, like I said, just efficient time. Also, if we can catch it ahead of time, it can stop the illness and the patient can actually go home sooner than expected. It actually can increase our profit at the hospital, even though we're trying to get the patient discharged in a timely manner. If they respect us and they know that they're comfortable and that they're in a safe hospital, they're more than likely going to come back to that same hospital to receive treatment because they trust us at that hospital. So the next slide we're going to go to is the chart demonstration. So unfortunately I couldn't find the one that my manager actually did, because when she went to her master's degree they actually did a chart of exactly the patient experience level and actually went up for our floor. The chart that I have for y'all is at a different hospital and has way more floors. They have like probably over 1,000 bed unit, which compared to Sentara it's like 300 bed unit. But anyway, it shows you exactly, if you do the nurse-led rounding, you will see more of an increase in patient experience, and that's our main goal at a hospital, is to make sure that the patient is happy, they're taken care of, and we're solving their medical illness. So why would the patients want to choose Sentara? So the reason why they want to choose Sentara is basically our motto is that I'm here for you, knowing that they are well taken care of, that they feel safe in the environment, know that their time and money is spent well at this hospital, because we're trying our hardest to make sure that they feel better. Next slide would be, would the nurse-led rounding be costly? Actually, more than likely if you do the nurse-led rounding and you get stuff done in a timely manner, costs will actually decrease. Like, it wouldn't cost a thing to do this. It actually help out the hospital. It will prevent patients from staying longer if we can find out the source of what's causing the patient's illness, and we have clear communication between the doctor, the nurse, case management, and the pharmacist. We can make sure that the patient is taken care of in the hospital in a timely manner, and also when they leave the hospital, we can have home health, or they can be discharged to a nursing facility, just to make sure that they are well taken care of is our best motto. And the nurse-led rounding would not cost a thing. And I feel like without the nurse-led rounding, we'll actually be spending more money because the patient will be there longer. Without it, communication wouldn't be as clear. And I think it's always important to have at least the doctor, the nurse, and the patient all in one, so you can communicate, stay on the same page. Because a lot of times I've had experience where there has been miscommunication when we didn't do the nurse-led rounding report. Like the doctor would go in there without the nurse and communicate with the patient. The patient was confused, and then of course the doctor's already left. The nurse goes in there and they're confused and they're upset, and then of course this all could have been prevented if we all had that interdisciplinary team rounding. So basically, when I mentioned about other competitors, I feel like if Sentara continues to do the nurse-led rounding, that they will actually beat out their competitors, because patients will see that, Sentara's organized, Sentara's on top of their game. They're not here to waste your time and money, that we actually care. So yeah, that's my presentation. I hope y'all enjoy it. And if y'all go to a local hospital or work at a hospital, please mention that to your nurses and your case manager, doctor, and even manager, just to please do the nurse-led rounding. It helps our patients out, and it keeps them safe, and it actually helps them in the long run. Thanks.